So, some intervention strategies to help a 6-month-old with a diagnosis of spinal muscle atrophy would be first to take into account what OT's role is, and that is to maximize our client's functional independence. A good intervention strategy for typically a 6-month-old would be to educate their parent or caregiver, and this would be involve teaching them what they should be expecting when raising a child with spinal muscle atrophy. Um, there's going to be, as they get older, some communication difficulties. The child may not be able to speak very well and may need to use assistive technology to do so. Also, assistive devices will most likely become an everyday commonality for a child with spinal muscle atrophy. Wheelchairs and gait trainers will most likely be used, especially for a child with type 1 SMA. Orthotics, daytime bracing, and nighttime bracing will all need to be used, and they'll need to be taught how to don and doff these correctly to ensure that the child is getting the proper stretches and tensions on the muscles that could possibly be atrophying. Proper body positioning is also essential, especially when a child is 6 months old. It's important to use proper body mechanics. The earlier, the better for a child with this diagnosis to prevent down the road contractures. Proper body positioning during meals is important to help with swallowing. A turning schedule may have to be implemented, and a night nurse may need to be hired in order to help the child turn to prevent any skin breakdown. And wheelchair education on proper fitting and padding will also need to be educated on the parents. Feeding for a child of 6 months old um, will help strengthen the muscles involved in mastication through our therapy, and an OT may need to manually chew to help strengthen some of these muscles. To prevent some deconditioning during muscle atrophy, that's mainly to prevent contractures. Splinting will most likely have to be implemented, and also range of motion exercises to help their muscles stay limber and loose so that they don't tighten up. Lastly, encouraging maximal participation of the client's ADLs will also help the child move their body and decrease risk for contractures.